two things I want to talk about are fit for purpose and garbage in, garbage out. So fit for purpose is a actually undefined concept, but we all use it all the time to say, you know, when we're trying to use data to make a transformation into information and knowledge on a certain topic, was that data created for that purpose, or was it created for a completely different purpose? And the classic, and just to bring everybody back for a minute, most real-world data studies are so-called secondary use of data. So what does that mean? Well, that means that the data wasn't intended for that use. The primary use is patient care. The primary use is billing. And the primary use is liability-related information. So whenever we're doing research or we're trying to use data for a regulatory purpose, that's a secondary use, and this whole question of fit for purpose really comes up. The other thing, it's colloquial, but it's absolutely true. Garbage in, garbage out. And the problem is that the documentation that we create as clinicians tends to be not as good as it could be. It tends to be sometimes too brief or cryptic or ambiguous. I'm guilty as the next person is occasionally copying data forward, copying my last note forward. And if you forget to remove something, you get ambiguities within a note. Well, how is someone to come in and figure out what's going on there? It's really difficult for a human to look at that, and much less a computer if you want to automate the whole process of creating real-world data. So it all does come back to the basics, and I like to say this all the time. I was never trained in how to do clinical documentation. I learned all kinds of things in medical school, things I don't need anymore, such as the muscles in my hand, but I was never really taught how to write a good note, except a very informal process during the training. I feel strongly that that's got to change. There's so much that you can learn on how to make a good document, even medical school going forward, and that will just make the whole process smoother, both for real-world data studies and frankly for clinical trials.